I knew it's something. I didn't know exactly what it's from. Anyway.
All right. For the video record, it's April the 28th, 2010. It's 10:35 a.m. And we're here today on Loretta Hussey versus Kieran Chris, cause number CT 001032-07, Division 3. My name is Ben Taylor. I'm here on behalf of the plaintiff.
I'm Melanie Stewart, and I represent Ms. Chris.
And we're here to take the deposition of Dr. Pickering. You will go ahead and swear.
You solemnly swear the testimony about giving this cause to be the truth, the whole truth, and nothing but the truth, so help you God.
I do. Did she give you a copy of my
CV?
CV?
I do not, but if we could just make that, I guess, the fourth exhibit.
That's fine.
That's fine.
Let me, because it might take her a minute to get that.
Okay.
Hey, Pam? CD? There you go.
Okay.
Here we go.
We'll go ahead and mark that. Doctor, would you please introduce yourself to the jury?
Yes, I'm Rob Pickering, orthopedic surgeon.
Okay. And orthopedic surgery, I guess, what's the nature of that profession?
We take care of disorders of the bones, joints, tendons, ligaments, nerves, and the extremities.
Okay. And can you tell the jury what state you're licensed in?
Mississippi and Tennessee.
Okay. And how long have you been licensed in orthopedic surgery?
Well, I've been licensed to practice medicine for about 18 years, 19 years. I'm an orthopedic surgeon for 14 years.
Okay. And can you tell the jury about any type of other certifications or anything that you have?
I'm board certified in orthopedic surgery.
Okay. And can you explain to the jury how you become specialized or how you become board certified?
Well, after college, you do 4 years of medical school. You get your MD, and then 5 years of orthopedic surgery training. After that, then we have to go through a couple of years of practice, and you take a test to get board certified.
And I guess your practice now, you are with Ortho One?
I am.
Okay, and you've got offices in Tennessee and Mississippi?
Tennessee and Mississippi.
And then prior to Ortho One, you were with Campbell Clinic?
Right, for 12 years.
Okay. At this point in time, I'd like to go ahead and tender him as an expert in orthopedic surgery.
Okay.
You okay with that? Do you want to ask him any questions? Or?
I may later.
Okay, well, go ahead. If you
No,
want.
I'm not going to go ahead right now. Go ahead.
Okay. Doctor, have you had an occasion to treat with a Loretta Hussey?
I have.
Okay. And do the records show how you first came to see her?
I believe that the first time that I saw her was on April the 13th of 2006.
Okay. And how did she present to your clinic?
She told me that she'd been in a motor vehicle accident on the 9th of March.
And I guess she gave you a history on that day. What all did she relate to you?
She just told me that on that day that she'd had a motor vehicle accident and that she'd been having some pain and swelling in her knee, as well as some numbness in her knee and swelling in her left leg, and she came in for evaluation of that.
And I guess, did you perform an examination of her on that day?
I did.
And what examination did you perform?
I looked at her and her knee, and she had essentially a full range of motion of her knee. She did have some laxity, checking the ligaments in her knee, and she had some swelling in her knee.
Okay. And what did you recommend at that point?
We did some x-rays at that point in time of her knee that showed that looked like she might have a fracture in her in the tibia, which is the lower bone in the knee, and maybe where the one of the cruciate ligaments, one of the ligaments in the knee, inserted. So I recommended that we get an MRI for that and scheduled that test.
And doctor, what were the results of the MRI?
The MRI confirmed that there was a non-displaced fracture. It said in the posterior 2/3 of the tibial eminence, but that's the part of the bone where the PCL attaches, which is what we suspected by X-rays. And it also showed some signal abnormalities in the PCL, suggesting that that ligament had been damaged as well, but no other meniscal injury or other injury.
Doctor, after your, I guess, history and examination of Ms. Hussey, did you arrive at a diagnosis of her condition?
I did, and that's really what I thought the initial time. That was a PCL avulsion, a PCL injury, one of the posterior cruciate ligament in the knee.
And can you explain to the jury what, I guess, how that injury comes about? Or
That's usually from a direct blow. Well, a lot of times it's from a direct blow injury to the knee. The PCL is what keeps the lower leg bone from shifting back. So if you get a direct blow, it'll push that bone back, and it can tear the ligament the check rein to keep it from moving backwards and forwards.
And is there anything unusual with your particular diagnosis and Mrs. Hussey, given the history that she gave you?
No, that would be consistent with if you had a dashboard type injury to your knee.
Okay. So, doctor, I guess, do you have an opinion based upon a reasonable degree of medical probability as to the cause of the condition of Mrs. Hussey?
I believe it was related to her injury that she had in her motor vehicle accident.
Okay. And that was on, I guess, what date did you have?
March the 9th of 2006 is what she told me.
Okay. Doctor, when did you see her next?
On April the 25th of 2006.
And how did she present on you that day?
She basically came back to get the results of her MRI, and and told her that it had confirmed that, and she had already been placed in a brace to hopefully help the ligament to heal.
Okay. And I guess you see her again after that?
I did. I saw her on June the 5th of 2006, and at that point in time, she was doing fairly well. She had regained all of her motion. She still had some laxity. I had her in a therapy program, and I asked her to return back one more time in about 3 months for a final follow-up.
And can you describe to the jury what the therapy program was?
They would have put her on some strengthening of the muscles in her leg to help compensate for the laxity that she had as a result of her ligamentous injury.
And can you explain to the jury what laxity is?
Looseness.
Okay. And I guess her condition, is that a painful condition?
Object to the form.
The injury's painful. I mean, she had technically a fracture in her knee. I mean, it's really painful.
Okay. And doctor, I guess, when was the next time that you saw her?
On September the 5th of 2006.
And how'd she present on you that day?
She came basically in for a final follow-up, and I looked at her and assessed her. She had good motion. She had a fair amount of laxity in her knee. She told me that she did have some trouble when she was trying to get up or down, or when she tried to squat. And I basically released her at that point in time and gave her an impairment rating.
Okay, and doctor, in that regard, do you have an opinion based upon a reasonable degree of medical probability that the injury to Miss Hussey's leg is permanent?
Object to the form.
I do. It is.
And I was going to say, what is that opinion?
It is permanent.
And can you describe to the jury, or explain to the jury, what an impairment rating is?
Yeah, an impairment rating is basically, there's a guide that the American Medical Association puts out, and it's basically a cookbook type of a thing. You look and you see, I mean, it's say like mild laxity, moderate laxity, of ACL, PCL, and it basically tells you what the impairment is based on the exam.
And doctor, I guess, what is that impairment rating?
Her impairment rating was 7% whole person impairment and 17% lower extremity impairment.
And that's two separate ratings. I guess, can you explain to the jury what a whole person impairment is versus scheduled member impairment?
Well, it's just the lower extremity impairment is what you give based on the injury, and then there's a conversion table in the chart that basically converts extremity from anywhere from the finger all the way up to the whole person. And you guys typically want to know the whole person impairment.
Okay. Doctor, do you have an opinion based upon a reasonable degree of medical probability that the permanency which you just described has any relationship to the auto accident?
Object to the former.
I believe so.
Okay. And doctor, based upon your experience in the area of medicine in which you specialize and the history given to you by the plaintiff, your examinations, diagnosis, can you tell the jury whether or not the plaintiff has experienced pain as a result of this injury?
Object to the former.
It is typically a painful injury.
Okay. And along that same line, based upon your experience in the area of medicine that you specialize in, the history given to you by the plaintiff, your examination, and diagnosis, can you tell the jury whether the plaintiff will experience any pain in the future as a result of this injury?
Object to the former.
There can be some increased wear and some pain associated with having some laxity that can be long term.
And do you know of any limitations that the plaintiff is under at this point in time?
I don't believe I gave her any limitations. I probably told her that she could do whatever she felt comfortable doing.
Doctor, I believe the last time that you saw Mrs. Hussey was here recently, prior to this deposition.
I did. I saw her on March the 15th of this year, of 2010.
And can you tell the jury how she presented to you on that day?
For her, she came back for her left knee.
And what were her complaints?
She told me that, actually I didn't have her records at that point in time, so we kind of had to go back through her history, but she told me that she was still having some discomfort in her knee, and she told me it didn't prevent her from doing anything, but that she did have some pain, particularly when she did yard work and going up and down, squatting, getting on her knees. She also had some tingling across the front part of her knee, and some swelling.
And doctor, is that consistent with everything that we've already talked about with her injury?
It is.
And I guess do you expect her to have those problems in the future?
Object to the former.
I do.
And doctor, I guess also to kind of explain to the jury, you were formerly with Campbell Clinic, and I
Right.
guess Miss Hussey went to see you when you were at Campbell.
That's correct.
And then you're with Ortho One now.
Right.
And so you had to order her records and everything. That's why
Correct.
you didn't have them
Right.
initially.
Right.
And we've marked your records, both from Ortho One and then also the records from Campbell Clinic that they provided to you as exhibit number 2. And I asked if you could identify those.
I believe that's a complete set of her records from both places.
And doctor, is that a record regularly kept in your business as
It
part
is.
of your business?
It is.
I've moved to introduce those as an exhibit. And then doctor, we've also got medical bills from various providers, and just for the record, counsel and I have, on this exhibit number 3, stipulated we're going to redact some of these additional past damage issues, so I'll just ask you not to look at these, just look at the medical providers up here at the top.
Mm-hmm.
And if you could look through those, it looks like the first one is the EMS service, and the next one is St. Francis Hospital's ER, then Memphis Physicians Radiology, Park Avenue Radiology, and then Campbell Clinic Orthopedics.
Mm-hmm.
And if you would look through those, and I'll ask you if you feel like those are necessary and reasonable charges for the treatment for the injuries that Mrs. Hussey sustained.
Object to the plan. Object to the foundation also.
Yeah, I believe so. I believe that's reasonable
Okay. And
and
Doctor,
necessary.
Doctor, I guess it's part of your practice. You treat people that have auto accident injuries or injuries related to auto accidents or other accidents. Is that correct?
Correct.
And you were with Campbell Clinic for 14 years?
12 years.
For 12 years? And just to go through that bill specifically, it looks like there was an office visit, $96 charge, and then there was an x-ray of $126, an MRI of her lower leg of $1,486, and then office visit, I guess that's with you, for $66.
Right.
Then some physical therapy charges. And I guess the total of that is $2,688 even. Is it your testimony that that's necessary and reasonable treatment for the
It is.
plaintiff?
Object to the plan.
And then I guess the same thing with these other providers, St. Francis Hospital. If we can scroll through those real quickly.
Yeah, I looked at them. I did.
Okay, you did
I
look
looked-
through
I looked at
those.
those. I think that's,
You don't see anything out of line with any of those charges?
I don't.
Object to the plan.
Okay. And then, Doctor, I don't know if there was any charges when, this is just Campbell Clinic. I don't know, do you have any idea what your charges would have been for this visit and,
I don't know exactly, but that would have been, it'd been 4 years. It would have been a new patient evaluation, and I took some x-rays, so we can get that for you, but I don't know exactly what it was.
okay. Well, if you can get that to us and we'll just supplement your deposition.
No, I need to know how much that charge is today before we leave the deposition.
We can do
While
that.
we're on the record, so that I can question that.
Well, can
I
guess-
don't have any idea what that would be.
Can they get it?
Okay, yeah, let's take a break. We'll go off the record. It's 10:55.